I'll hand over to Dr. Kate D'Ambrosis to facilitate our Q&A session. I'll kick us off with the first question, Dr. D'Ambrosis. Can Dupixent injections cause hair thinning?
Yeah, that's a great question. I can only answer really anecdotally. I don't know any literature surrounding alopecia or hair loss being a side effect. I probably have around 50 patients on dupilumab now, and I can quite confidently say I don't recall any of my patients having a complaint of hair thinning, but I'll check with Laura and see if she agrees.
I also don't have any patients who've had any hair thinning. There definitely have been a few case reports of alopecia areata being associated with Dupixent. So that's a specific autoimmune disorder that can affect hair and cause hair to fall. But interestingly, there's been more case reports that have shown that it is helpful for those patients and has caused hair growth. So I think it's going to be one of those things where it's a bit of a watch this space, but I wouldn't say it's a common side effect or a known side effect.
Yeah, and I think there is definitely an independent association with alopecia areata and eczema anyway. So yeah, we'll definitely have to watch that space. Second question, are there any recommendations or resources we can point to help children that struggle with sleep? Gosh, that's such a common phenomenon, isn't it? Sleep disturbance with eczema. Generally, I think reaching out to associations like EAA, EANZ are fabulous resources. I myself, through them, have a few things I can actually show you here that I think many years ago EAA helped me with some little books. So often when I have patients with eczema and which we're talking about the diagnosis, often they borrow one of my little kid-friendly books and they take it home. Some take it to school and show their teachers and their friends. I think it helps with their support team around them at home, really understands what's happening in their lives with eczema. In terms of sleep disturbance, I actually use it as a bit of a marker to how successful my treatment plans are going. So at a first consultation, it's probably almost universal for a young kid with eczema to be having a sleep disturbance. I think nocturnal scratching and itching is hugely inconvenient for the whole family, siblings and parents alike. That should really be dropping off if you're treating the eczema successfully. So that's usually one of my first questions on a review appointment is to how's the sleep, how's the family sleeping, who's been up, have you noticed any scratching, is there any blood on the sheets? Because to me, if that's still going on, then I really need to look at how I can better plan a treatment, a management plan for them. But Laura, did you want to add anything to that?
No, I completely agree with everything that you said. So I think sleep is obviously a huge thing for people with eczema and a huge thing for their carers. And it definitely, if people aren't getting enough sleep, I'm optimising their treatment further.
Our next question is for Vanessa. So Vanessa, where do you even start when you have to care for someone with eczema? So have you got any pointers in that regard?
That's a great question. It's quite a difficult question, really, because everybody's skin is so different and everybody's family unit is so different as well. I think to be informed is probably the first step. Go and get the information on the things that you can do at home, you know, things to support sleeping, the moisturizers that you need, all of that sort of thing. That's really where it's best to start, I think, is having the information available to you when you need it. So for example, somebody is having a flare up, whether it's a child or an adult, it's 2 o'clock in the morning, everybody's in tears, there's lots going on, and you need to have tangible information to be able to go, okay, this is how I'm going to deal with this situation. Without that, it becomes very overwhelming for everybody involved and can become extremely stressful. So yeah, definitely, I think my point would be get informed, get some information, you know, give the support agencies and organizations a call. Yeah, not so much the internet, but you know, sources like our websites really have good information for people.
Yeah, it's definitely, it's a well-worn path, isn't it? So why not take advice from people who've walked it before?
Exactly.
Next question I've got, I might shoot to you, Laura. It's a bit hard for me. But are there any links between autoimmune diseases like celiac and eczema? We talked about one before. Alopecia is definitely linked. I'm not aware of celiac being linked. Do you know of any other direct links?
I think that's a bit controversial. So I guess celiac disease, as you know, Kate and maybe Vanessa, it can be linked to a different type of dermatitis herpetiformis, but not atopic dermatitis. But then on the other hand, people who have atopic dermatitis may be allergic to wheat, but not necessarily celiac. So I think that's sort of a complex question, but a good question. No direct link, I don't think.
Yeah, I would generally advise that. The next question, thoughts on Dead Sea salt or apple cider vinegar baths for infants? I can't say I know exactly what Dead Sea salt is. I'd suggest it's a drying agent, which in eczema works well. That's for an infected type of eczema, not so well for the usual stock standard eczema. Apple cider vinegar also has an antibacterial property, so that's probably where that association or treatment has been advised. I do tend to, my tried and tested regime is potassium permanganate or Condy's crystals, which are a Schedule 3 drug available at pharmacies, so they don't require prescription in Australia, but they're kept behind the desk. I find they work fabulously in kids' eczema and infants, which this question was quite specific for, but infants, because they do tend to carry a lot of Staphylococcus aureus, one of the bacteria that tends to drive eczema, and that's just a result of them being often on the floor, in contact with a lot of fomites. That's not something that is abnormal to be on the skin, but in an eczema patient it can cause trouble. So Condy's crystal bath work really well to keep those staph levels low and hopefully help clear the eczema. Laura, did you want to add anything to that? Do you have any?
No, I think that was a perfect response.
Next question is, any ideas on how my daughter's eyebrows can grow back? She's scratched them out now and they won't grow back. So my approach to that would be to first check if it's only eczema related. Is there another disease at play here? Because alopecia areata, as we talked about before, does have a higher incidence in atopic patients. So I'd want to be checking that there's no alopecia or actual hair loss disorder at play. Then I'd check that the eczema's been properly treated in that location. If there's any inflammatory skin drive, that can impact hair regrowth. So turning that off with appropriate treatments would be ideal. If the skin can be normalized, I think you've got a really good chance of them growing back, because eczema is not generally a scarring to that depth disorder, so it should not be impacting that hair follicular bulb and should not be causing inability to grow back. So I think promising, but I wouldn't want to promise without seeing it. Next question, Laura, I might throw this to you. My little one has severe cerebral palsy and on many medications. Could these be a contributing factor to her flares?
Yeah, so that's a bit of a tough question because it really depends what medications this little one is on, and it also depends what the skin looks like during the flares. So definitely people can get medication-induced rashes, but I do find this tends to look a lot different to eczema. So it might be worth, getting this little one reviewed when she's having a flare to see, does this look like standard eczema that's flaring, or does it look like it might be a medication, allergy? To me, they look definitely a lot different.
Our next question is from Rosie and it reads, I'm interested in the JAK inhibitor used in America, mentioned by Laura. Would this be a safe alternative for a Dupixent user who experienced the very debilitating red face reaction, which is actually quite rare, and touch wood, I haven't had too much of that side effect, thank goodness. I haven't had any experience with abrocitinib, which is the JAK inhibitor that's being used in America. Have you had any experience with that agent in the hospital, Laura?
No. So that one is not available in Australia yet, but we do have upadacitinib, which is the JAK inhibitor available in Australia from the age of 12. I have had a couple of patients who've had reactions to Dupixent that I've switched over to upadacitinib, and because it's a completely different medication, touch wood, they seem to be doing okay on it. So it might be worth, depending on this person's age, maybe considering that switch if possible.
Yeah, my experience with Ibrutinib's been quite limited. I've only got 2 patients on it. Both are doing well now, but interestingly, I found it took a lot longer for them. I don't know if that's your experience also, to improve compared to the dupilumab patient, where you get that quite instant pruritus or itch relief, and then the skin follows quite quickly. But one of my patients is a needle phobic. She can't stand the idea of needles, and it's worked quite well for her as an oral tablet. Our next question is dupilumab available in New Zealand, and is it available for moderate eczema in adults? So we can talk from the Australian perspective. It is available for moderate to severe eczema in patients older than 12 at the moment. We're hoping to get it for younger patients soon. In New Zealand, I'm not aware.
So Dupixent, dupilumab is available in New Zealand on prescription. Unfortunately, it's not funded, so it is quite expensive. We're rocking around the $2,500 mark, and that's per month. So for a lot of average, $2,500 is the cost of 1 month's dose. Unfortunately, that's out of reach for majority of New Zealanders. So yeah, we're working on that. We're petitioning to Pharmac at the moment to get that one subsidised. It's very effective. My husband was on a 4-year trial for it, and it was 4 years that we didn't have to deal with any eczema, which was quite extraordinary. So yeah, I'd absolutely recommend it, but it is very expensive. So, you know,
an absolutely game-changing drug. So surely New Zealand won't be far behind with that.
We're hoping.
A question for Vanessa. What do you do to distress to help to cope with dealing with partner skin conditions? Do you have any more tips? So I think for both yourself and for your partner, how do you deal with the distress that eczema so commonly causes?
This has been something that we've had to learn. Nobody kind of said to me, oh, by the way, if you're going to commit to this, this is what you're going to be dealing with. It's really quite a major thing. So things like taking some time apart can be really helpful for both. Eczema it can be very overwhelming, both for the patient and for the carer. And I think, you know, we like to care for the people that we love. And when we are like, are you okay? Are you okay? Do you need this? Do you need that? It can become quite intensive. So what we discovered after a few years was, you know, just a few hours a weekend here and there is actually really, really good for our mental sanity, you know, if you can deal with that. So another one would be to maybe be outside. It's really difficult for eczema patients to do that sometimes, but you pick a time of the day where it's not really windy or, you know, really hot and all of that kind of thing, and you just go for a little walk around the block if you need to. Being out in the fresh air, you know, doing some breathing exercises and things like that has really helped me. I've now taught my husband how to do breathing exercises and to, you know, pressure points when things are getting a little bit stressful and stuff like that. And music's been a really big part of how we, as a family unit as well as individually, bring the mood down, if you will. If we've had a really rough night, you know, our daughter who's 5, it doesn't have eczema, but she gets really itchy skin. So we have a lot of sleepless nights. And so we find that music's a really great way of de-stressing. There's a lot of other tips and tricks. So please reach out to me at EANZ if you've got any more requests for that.
Great tips, thank you. A question for Amanda. What is the general opinion regarding bleach baths for flare-ups? Laura, do you want to take that one?
I routinely use bleach baths for eczema, particularly for younger children. I find it to be very effective. I will use it for patients that have had lots of secondary infections, and I will use it for patients who have lots of scratched skin that's just a sitter for infection. So the bleach baths have been shown to be beneficial at reducing infection, but also reducing the inflammation of the skin itself. It's important if you're going to do a bleach bath that you use a proper prescribed recipe, because there have been reported incidents of people making them too strong with quite dire consequences. So it is actually only a very small percentage of bleach. I tend to balance the pH with a little bit of salt, and then also adding some plain bath oil into the mix just to rehydrate the skin. But I use it quite routinely, and I find that it can be very effective, especially at reducing the amount of oral antibiotics that people would otherwise need.
The next question says, my daughter now has eczema all over, but also red skin, and I feel she has red skin syndrome after taking a break from topical steroids. I'm not sure what to do and how long this will last. So it sounds like, if I was the mother of this child, I would be quite stressed. I would advise getting an opinion by a dermatologist. I mean, we are trained to manage this very scenario, so I think it's probably a bit fraught for me to advise without actually seeing your daughter's skin, but I do feel that you should be able to get great advice from a dermatologist as to where to go next and how to best help her skin. It's not something that you should or need to be dealing with by yourself, and I think that would be very stressful to feel that you have to. So reach out if I can be of any help in getting some dermatology care for you. The last question I've got here is, I've read that oral ceramides, I think Laura was talking about earlier, are more effective than topical ones. So Laura, do you have an opinion on this?
Look, I think there's been maybe 1 or 2 very small studies that have suggested oral ceramides can be effective. It's not the sort of thing I'd be recommending routinely until there's a lot more robust evidence. I think when it comes to topical, there's a lot of evidence available, but with oral ceramides, I think it's probably a bit of a watch this space.
Yeah, I'm not aware of any oral ceramides, but I think eczema, a lot of the treatments are most effective if we can rebarrier, restore that skin. So putting them on topically is probably the safest and most effective option that we have. Okay, so I might hand back to Michaela. I think that's all the questions we have.
Thank you so much. And I think those questions were really good. And I know we had a number of questions on here now that we weren't able to get to. So please do reach out to us, corporate@eczema.org.au. We'd love to give you some additional information and send through these additional questions to our dermatologists as well. But that is time on our Eczema Awareness Month Q&A webinar. Thank you so much to everyone who registered and joined us today. I also want to say a massive thank you to our panelists, Vanessa, Dr. Kate D'Ambrosio and Dr. Laura Weller, for offering up your time and providing some wonderful insights into eczema, upcoming treatments and how to best manage the condition.